Hello, I'm Dr. Shefali Karkhanis. I'm a practicing diabetes specialist in Thane, Mumbai. Today I'm going to talk about a different topic called gestational diabetes. What is gestational diabetes? Is diabetes when it's diagnosed first during the pregnancy. It is called as gestational diabetes. This can occur all throughout the 9 months of pregnancy. It does not mean that it will last forever. In 90% of the patients, after the delivery of the child, the diabetes also disappears. However, there are a few patients who will continue to have diabetes even after delivery of the child. Why does it occur? Of course, it's an interplay of hormones. The pregnant womb is like a firecracker, it's an atom bomb of hormones. So there are a lot of hormones which are released in the mother's body during the pregnancy. This increases the need for insulin from the mother, and when this demand is not met, that is when you develop gestational diabetes. 90% of the times after the delivery, these pregnancy hormones come back to normal, and so does your diabetes. If it continues, well, you've developed diabetes for life. Who are at risk of developing diabetes during pregnancy are the patients who have a family history of diabetes, patients who are more than 25 years of age, patients who have a history of having developed diabetes during the previous pregnancies, patients who have delivered a child who is more than 3.5 kg in birth weight, patients who have had a history of miscarriages or spontaneous abortions in the past, patients who have had a history of PCOS or polycystic ovarian diseases, a patient who has obesity, that is overweight before pregnancy, patients who have had a history of hypertension or blood pressure before pregnancy, patients who have had acanthosis, that means blackish discoloration beneath your neckline as well as beneath your armpit, which are signs of insulin resistance, patients who have had delivered a child with malformations or with some kind of abnormalities. All of these patients are at high risk of developing diabetes. So are they the only people who should be screened? No. Every pregnant lady must undergo a screening for diabetes at the time when you're diagnosed with pregnancy. So the day you come to know the good news about being pregnant, you must test for diabetes to make sure that your pregnancy is healthy all throughout. It's a very easy test. You have to, the obstetrician at the time of the first visit will give you a glucose load, and 1 hour later there is a blood sample which is collected. This is called a spot test for diabetes. Now if this is positive, then you have to undergo a little elaborate test called oral glucose tolerance test, wherein you go on a fasting stomach, they collect the blood sample, another glucose load is given, and periodically samples are collected. Any one of the sugars which if they are high, you are diagnosed with having gestational diabetes and you will need treatment immediately. There is another test called HbA1c. HbA1c will give you an average of the last 2 to 3 months, and if this is positive, then again you are diabetic. During the pregnancy you will have to have immediate treatment and will have to continue treatment probably throughout the pregnancy. HbA1c is a very important factor because the higher the HbA1c, the more is the risk for you to develop complications as well as your child to develop problems. So the higher HbA1c levels, that means the patient probably has diabetes even before the onset of pregnancy, and it was just not diagnosed at that time. So uncontrolled hyperglycemia is associated with a higher rate of miscarriages, a higher complications in mother, and higher congenital anomalies in the baby. Early diagnosis is very, very important, and so is the control of blood sugars all throughout the pregnancy. Now we know that there is only 9 months that you've got with the fetus. So every day is extremely important for the child as well as for you. So control of sugars every single day is essential. There cannot be any cheat days during the pregnancy and diabetic control. The effects on the baby are many. The most commonly we see that the baby is a big baby, that is the birth weight is almost more than 3.5 kgs. Sometimes the liquor, that is the fluid inside the womb, is also very, very high. There can be heart defects, there can be spinal defects, most common being spina bifida. There can be brain defects in the child. Sometimes these patients, these babies are of very low weight. Yeah, so that can be one of the things. The respiratory system, the lungs are not very well developed in these children, so they might have to be put on ventilators after delivery. There might be a chance of kidney malformations in the child. So all of these things are very, very important. Similarly, on the mother also, in the mother there can be increased chances of infection, whether it is urinary infection, whether it is vaginal infections. There can be there can be repeated spontaneous miscarriages or abortions. They can have blood pressure during the pregnancy just because they are not controlled with diabetes. They can have vascular complications. These patients have a higher risk of going into preterm labor. That means delivering before the 9 months are completed. They are more prone for placental bleeding or bleeding through the vagina during the pregnancy. And of course, preeclampsia and eclampsia, that means fits or seizures during the pregnancy. Treatment of diabetes in pregnancy is very simple, okay, and it has to be maintained. The goal for treatment is a lot lower than the normal person, so we attempt to target the fasting values at around 95 and the postprandial or after food values at around 120. The diet forms a very important part of treatment of diabetes. The calorie restriction is not so much because now you are eating for 2 people, so you have to have a nutritionally balanced meal. So we do not restrict the calories, but we restrict the calories from carbohydrates. Simple sugars and sweets are absolute no-no. You cannot have any form of sweet all throughout the pregnancy if you are a diabetic. Diet has to be well planned and well balanced. So your nutritional compromises should not happen. It is ideal that you meet a dietitian before you start with this kind of a diet. Exercise, again, if you are permitted by the obstetrician, only and only then exercise is recommended. I generally recommend my patients simple walking, half an hour 2 times a day, or yoga under the guidance of experts. But again, this has to be done only and only if your obstetrician agrees to that fact. Coming to the medications, oral hypoglycemic agents are not deemed safe for use during pregnancy, except for metformin, which can be used in the earlier half. Insulin is the drug of choice for pregnancy. The sound of insulin gets everyone scared. There will be 100 other people who will come and tell you that this means that you're in the last stage of diabetes, or this means you'll get addicted to the insulin, etc., etc., etc. This is not the case. Insulin is very safe to be given in diabetes because it not only promotes healing, but it also is very good for control of sugars. Only thing is, it is an injectable. So yes, you have to inject yourself once a day, maybe twice a day, maybe 3 times a day, depending upon how your sugar levels vary. Always remember that the requirement of insulin will increase as the pregnancy grows. So as your child is becoming bigger, your hormones are getting haywire, and your insulin levels also will keep on increasing. So there is nothing wrong with that. You have to realize that 90% of the times after delivery, when the sugars come back to normal, the dosage of insulin also stops. Even if your sugars do continue after delivery, the requirement of insulin will come down drastically. So it will not be the same amount of insulin that you will be requiring as you required during your pregnancy. If you do continue to have diabetes, it is advisable to continue insulin till the time that you are breastfeeding the child, because again, it is safe for both you as well as the child. However, once the child is big enough, is weaned off the milk, you can go back to having oral medications. So definitely insulin is not addictive, so you can be rest assured about that. All the complications of the child as well as the mother can be easily avoided just by early diagnosis and by correct treatment of your diabetes all throughout your pregnancy, and that is what every patient should aim at. A regular follow-up is a must with your diabetologist as well as your obstetrician, because just because you do not feel it does not mean that it is there. So don't wait for symptoms to appear, because by the time the symptoms appear in you, it might be too late for both you as well as your child. So take care of your pregnancy right now. Thank you. If you have any other queries, you can contact me at Lybrate.